Audio check. Good day, and welcome to another segment of Living Well with Adena. My name is Dr. Kataka, and we're thrilled that you've taken time out of your day to join us. Today we have a great topic about moms and newborns. And today we're going to be joined by two wonderful physicians from Adena Health System that I'll introduce in just a moment. As always, we're always interested in hearing your questions or comments, so feel free to place them down in the box below. We have staff that are ready on standby to provide those questions to our wonderful guests, and we'll get those answers out to you shortly. You know, I don't have to tell you that COVID has changed our world. It's changed how we operate both inside and outside of the hospital. And for moms and for those who are expecting, this can be kind of an unsettling time. And so we're going to learn today and be given great advice from these wonderful physicians about how to handle pregnancy, what to expect, what has changed, and how to take care of your wonderful newborn once he or she has arrived into the world. So today I'd like to introduce our guests. On my right here is Dr. Rebecca Pareja. She's an obstetrician gynecologist from Adena Women's and Health at the Blackwater location. And Dr. Lois Jetty, who is a pediatrician with us from Adena Pediatrics.
Yeah.
Welcome, doctors. We're glad that you're here with us.
Thank you.
Dr. Pareja, I'll start with you. Tell us a little bit about yourself.
I'm Dr. Rebecca Pareja. I work with Dr. Villarreal and Regan at the Blackwater location for obstetrics and gynecology. I'm from North Carolina. I was born and raised there. I went to NC State undergrad and then Wake Forest for med school, and then got to complete residency at OSU. So,
welcome.
Yeah,
How long have you been with Adena?
I'm going into my second year.
Second year?
Yes,
Fantastic.
absolutely.
And you enjoying your time here in Ohio?
So far, so good. Yeah, residency taught me a lot, and I learned a lot about just Ohio and the Midwest, having been from the South, and I loved it enough to stay. And so far, I've had a really great time meeting the people and love the staff on labor and delivery.
Well, we're glad that you've been here for the last couple of years. Dr. Jetty, I know you've been here more than a couple of years, so tell the audience a little bit about yourself for those that you don't know you.
Okay, I'm Dr. Lois Jetty, and I'm a pediatrician working with Adena Pediatrics. And even before Adena Pediatrics, it was known as Smith and Fletcher Pediatrics, which was a very reputable group of pediatricians that started the practice here. So I joined the group in 1997, which is like ages ago. So my husband and myself, who is also a pediatrician, we are glad to be in this community, and we've been privileged to stay here for this long and to become part of the community.
Thank you, Dr. Jetty. I've actually had the opportunity to know Dr. Jetty for well over 20 years, and she is just a valuable addition and has taken care of numerous children in the area. And we're glad and we're welcome that Dr. Pareja has joined to add to those children in the area as well. So we're glad that you're here. So Dr. Pareja, I'm going to start off with you first, particularly from the aspect of pregnancy. So there's a lot of unknowns out there, but can you help our audience to kind of know, what do we know about COVID and pregnancy?
So I feel like this is probably everywhere with COVID and in every department, but there's not a lot, unfortunately, and not a lot of research that's done. But what we do know is that there are more pregnant women than women who are unpregnant in the ICU with COVID. We don't see that a lot here necessarily in Chillicothe, but definitely at Ohio State, for example. A lot of my colleagues up there have a whole different slew of patients who are pregnant, who do require ICU admissions, primarily for the respiratory support that they need. It's obviously in pregnancy, your abdomen gets bigger, and anatomically that causes a lot of your lung volume to be decreased. And so the risk of pneumonia and extra issues with breathing and oxygenation, that's a bigger concern that we have with pregnant women. And again, not necessarily here in Chillicothe, but that is a big thing we're finding nationwide, especially in larger cities. Long-term outcome really isn't that different necessarily. There isn't an increase in death necessarily, but the morbidity is higher in pregnant women, and we do see that with COVID.
Understood. So I think I heard you say that one of the potential reasons that pregnant women are needing more help with breathing is that there are changes in pregnancy.
Correct.
So do I understand correctly that the baby's getting larger and growing, and that's pushing up against the diaphragm?
Absolutely. It's more difficult, as we all know, to take a deep breath when there's another human inside of you. So it is definitely more difficult for them to clear their air and to get full lung capacity, especially in their later third trimester.
Dr. Pareja, do you know of data around minority pregnancies? So women who of color, Hispanic, Asian, do we know anything more about that particular subgroup?
I think the bigger issue with that isn't necessarily like a biological issue. I think it's more of a socioeconomic status, unfortunately, and the disparity in healthcare, that we do tend to see that more often in Blacks, Hispanics, and Indians as well. But it is not necessarily a genetic component. It is definitely their availability and ability to get adequate health care.
Okay. I'm sure there are a lot of mothers out there who might have a concern about either getting pregnant or are pregnant now and transmitting the virus to the fetus. Dr. Pareja, can you tell us what you know from an obstetrical point of view?
So you mean like if they are pregnant with COVID or being pregnant and getting COVID, what could happen to baby?
Sure, a great clarifying question. I'm glad you asked. So I think the question is if a mom has COVID, what is her chance or risk of spreading that while pregnant to her baby?
Okay, so with that, I think there have been some cases we see of preterm delivery. That doesn't necessarily mean it puts you into preterm labor. It just means mothers get delivered earlier than they should, which would be less than 37 weeks. And that could be for a multitude of reasons completely unrelated to COVID. It just so happened that you were positive for it. Likewise, there are some patients, primarily not here, but in larger cities too, that have had some pretty significant medical effects, respiratorily speaking, and their babies have made it far enough that delivery is better for both mom and baby at that time. But an actual component with the fetus, we have not necessarily seen that and cannot prove that in the cases that we've had.
So when a mom's coming in and seeing you for her routine OBGYN care, is there anything different that you're doing to monitor that?
So to monitor the baby, or just what we do preventatively speaking?
Either, yeah.
So preventatively speaking, we take adequate precautions with our PPE and making sure we're sanitizing everything and recommending moms do the same, both at home, at work, etc. We do limit the amount of people that come into the office, mothers and their significant other plus one, whether it be father of baby or mother of patient, just for the very important and sentimental appointments like the dating ultrasound, finding how far along you are, the anatomy ultrasound, finding what you're having. And so we do that just to limit the total number of influx patients in an office. It's not just one provider, it's multiple providers, the staff, etc.
So if I hear you correctly, moms can still bring in significant others or people who have a significant interest with the ultrasound,
right,
etc.
Absolutely. We precaution everyone with phone calls prior to and calling in ahead before they actually come into the office. And we do screen them and say if you're having symptoms of COVID, which sometimes kind of feel a little not very specific, I guess. They're very similar to that of the cold, sometimes the flu. But we ask you those questions and we ask that if you have any of those symptoms to reschedule. You're not just thinking about yourself, you're thinking about others, other pregnant moms that are there with their significant others. So we do try to attack that outside of the office as well and keep people safe from coming into an office that could have infected patients.
Okay. You mentioned in one of your answers PPE, and I think a lot of us out there have heard PPE a lot in news releases, press conferences, etc. And it does stand for personal protective equipment. Can you give our audience a little idea of what might be different with the PPE world when they come into the office?
Right, no, for sure. And we use slang all the time like that, unfortunately, acronyms. Yeah, we're very good at that. So we apologize for that. And I apologize for those who use that too. But so that includes a multitude of things. It can be masks, it can be certain outfits that we wear predominantly in the hospital. So if you have a COVID positive patient there, we have what we call them bunny suits. But you kind of zip into it, and it's kind of looks like a mini astronaut, if you will. And we have extra half masks and then N95s that we wear with patients that we know have COVID. And we have had some patients on labor and delivery that have tested positive knowingly. We have separate rooms for them that kind of help remove the air from that room outward. They're called negative pressure rooms. Our OR also has that too, and those are held specifically for patients that we know are positive and coming in. Likewise, there will be a 1-to-1 nurse ratio with them, and that nurse has her bunny suit, has her mask, and she only goes in and out of that room and preps herself accordingly in and out of that. That's predominantly in the hospital setting. In the office setting, masks are donned on everyone, and everyone that comes in, they have to wear one. Gloves are used, sanitation is used. We always ask our patients to wash their hands, obviously on the regular, and as we do as well, there are stations set up for Purell 60% at least is what we recommend, just to get all the bacteria and viruses that we can off our hands, but we do find hand washing superior to that of hand sanitizer.
Sounds like you've taken a lot of steps to help
Yeah.
moms or future moms feel comfortable.
Absolutely.
So should a mom be concerned if she's going to deliver about coming into the hospital then?
I think we're doing our best, and per those who are very, very smart across the country, giving the recommendations on how to keep our hospitals as safe as possible, especially labor and delivery and our newborn babies, because they're so fresh and so new, and their immune systems aren't ready for what this world has to offer. So yeah, I think we're doing great steps with our hand washing and with our protective equipment that we're wearing, or clothing that we're wearing, whether that be bunny suits or masks or specific headgear that we have to wear. Some of us do face shields as well as that with our N95s too. So I think our hospital has done a great job. I can at least speak for labor and delivery, doing that and abiding by all of the rules and regulations that we have.
That's awesome.
Absolutely.
So a lot of steps that you're taking from the hospital perspective or in the office perspective. And so I hope that gives our viewers some idea of what to expect when they come in. Dr. Preja, can you help us to understand outside of the hospital? So at home, what could or what should pregnant women do to keep themselves as healthy as possible and to decrease their risk of contracting COVID?
I think the typical things that you hear on the news and have heard for months is wearing the mask. And I know the distance changed from 3 feet, et cetera. It's 6 feet as far as that's what we're going by, is a 6 feet distance. You don't have to go somewhere public. Don't. That's really for everyone, not necessarily for pregnant women. They were saying buy in bulk, which is nice. It prevents less trips to the grocery, et cetera. I think a big thing that is missed and is happening, unfortunately, is that people are staying stagnant in their homes and not moving. I want you to keep moving, especially if you're pregnant. Activity and exercise is healthy, good for your mental health, it's good for your physical health and for baby. And so whether it be taking laps around where you live, apartment, home, whatever, it's outside, it's still beautiful, although hot, so hydrate. But yeah, absolutely. I think still live your life, but be just cautious in public settings, and whether or not it's a have to, or can we clump and go once every 2 weeks, once a month, etc.
I like that. So be cautious.
Absolutely.
Not necessarily worried, but cautious.
Correct.
Right? Love that. And we'll get a chance to hear also from Dr. Jetty from the newborn or child perspective. But what would advice? I'm sure there are some folks out there who are saying, "I'm not pregnant now. I'm thinking about that. Should I get pregnant now, or should I wait till COVID completely goes away?" What would be some advice there?
I think that we have taken adequate precautions as far as we know to prevent any poor outcomes, right? I think pregnancy is a beautiful thing, and if the timing is right in your life to do it, I say do it. I say, from our standpoint, and I know Dr. Jetty will hit on this, we don't know if there are any neonatal effects at this time. We haven't seen it yet. But yes, I would recommend that it's still okay, and people are still doing it, so it's fine. But yeah, I would definitely say doing the things that we're all trying to do across the United States to stay healthy and stay informed and educated, keeping ourselves and others next to us as healthy as possible. So yeah.
And would you be open if one of the patients wanted to talk to you about pregnancy planning? Was that an option to come in and chat with you about that as well?
Yes, absolutely.
Perfect. So we'll kind of relay where people can come in and talk to you about that, and your colleagues as well.
We would love it. Yeah, we have people do that already, so we would love that.
Okay, perfect. We're going to kind of switch gears a little bit. We've heard now Dr. Preja talk to us about from a mother's point of view. I'm going to ask Dr. Jetty from the other point of view, from the newborn or from the infant. So same kind of question, but with a different patient, Dr. Jetty. What's a newborn's risk for COVID-19?
As far as we know, as of now, it is really low because there's no current evidence that shows that a baby, the newborn, can get COVID from the mom during the pregnancy or during the delivery. And but there have been some reports that they think that the baby might have gotten from the mom during the delivery, but those are very, very far and below.
So let me make sure I understand correctly. As far as we know from the from research, there isn't a transmission when the baby's inside, growing inside the mom. So for our audience, some of you may have known about the Zika virus. Can you tell us a little bit about how that was different, Dr. Jetty?
Yeah, that was different. Like, I know I'm not the authority on it, but at that time, like with the Zika virus, it was like anyone can get the illness, but the concern was more with the moms who were in early pregnancy, that the baby could be affected and that we wouldn't really know until the baby is born. That was a big concern at that time. So there was more counseling about not getting pregnant during those times or not going to the places where that was more prevalent. So
that's some good news then, I
Yeah.
suppose, if there is good news with COVID.
Yeah.
That what
And-
we can see is there's not that transmission to the baby while the baby's growing inside the mom.
Yeah, and with COVID, the other thing that's a little different from the other viruses, the viruses or bacterial infections, we always felt that the newborns were at risk. The newborns or younger children were at risk of getting the infections more severely. But in this case, it has been shown that even when there is a COVID positive mom, the baby is completely healthy even at the time the baby is born. So the risk to the newborn is just like to all of us. The risk is after the baby is born through the contact with the infected person, and that can be the mom herself, it can be the father, it can be the siblings, it can be anybody that's coming in contact with the baby after the birth. So that's the reason, even with the hospitals, we have like where there's restricted visitors policy, both for the safety of the moms and the newborns. So because that is decreasing the exposure to the virus to as minimal as possible.
I see. So in the past, where maybe grandma, grandpa, uncle, cousin, brothers and sisters could all come at the same time, you're really limiting that for the
limiting.
safety of both the mom
Mom.
and for the newborn. Is that right?
That's right.
So I'm sure there's some questions out there for let's in the scenario of a mom who comes in, she's not known to have COVID, she hasn't had a positive test. Can you kind of walk through for our audience what are some of the things that you're doing perhaps differently now that we're living in COVID? For the delivery of the baby when the baby
delivery,
comes.
yeah. And I think even for the delivery, just like for all of the hospitalized patients, they are limiting the number of visitors even during the time of the delivery. So it's limited to one person, because we have been through the days where the whole family is right there in the labor room or outside the labor room, but now it is not possible. You have just one person being there with the mom, so that limits the number of exposure. But then also taking care of the staff themselves too, because so we shouldn't be the risk to the patient too. So using all the PPE that Dr. Pareja was mentioning, and doing all those isolation techniques so that we are not a risk to the mom and then indirectly to the baby too.
Okay. So Dr. Pareja, let's talk in the instance of, let's say you know a mom's positive. So you have a patient, she's pregnant, she's getting ready to deliver, but she does have a positive COVID-19 test. What will be different for that delivery?
So, like one of the rooms that we discussed, there's one room on labor and delivery. I believe it's only one, there may be two, but definitely the one room that is negative pressure. So we would reserve those for that patient. She would enter in that room.
And can you tell the audience a little bit what you mean by negative pressure?
So it removes kind of the air circulating in that room and doesn't recirculate it out into other rooms on the floor. So that
that's
you're not,
important.
Right. So
Okay.
you're not necessarily spreading that. In the operating room, if this patient were to require a C-section, because she has a history of C-section, is the same way. Everyone in the room would be masked appropriately, so it'd have some form of an N95 and or a half mask that would prevent the transmission of the COVID virus to the people that are taking care of the patient. The patient is still able to have her +1 there. Again, such as Dr. Jetty said, excuse me, it's 1 in, 1 out, none back in. So if your +1 leaves, that +1 is now gone, and a mom can't come in. It doesn't work that way, unfortunately. But yes, so we will all have the appropriate masks on, the face shield, the proper gowning, nursing as well. So we will all be masked and enter the room and exit the room very similarly, how I kind of discussed earlier with the bunny suits and then exiting appropriately.
And did I hear you correctly previously that there's a one-to-one nurse with the patient? And
Correct.
Can you tell us what that means?
So one-to-one meaning if the nurse in the beginning, let's say you come in and you broke your water. If that nurse was the one that had checked you in, she will be with you the entire time because she met you at time of entrance and now exposure, so she'll be with you the entirety of that time. That's from admission to delivery.
I've never personally had a baby myself, but I think that's actually kind of a nice,
Yes,
I guess,
absolutely.
benefit, if you had to look
Yes.
for a silver lining in this, that you have a personal one-on-one care.
Absolutely, absolutely.
Now, does the obstetrician communicate with the pediatrician in advance? And does the pediatrician know what he or she is walking into? How does that work? How do you two work in coordination when it comes to delivery of a positive COVID mother?
We definitely try always to hook up our pediatricians, whoever's on call, when we ever have any kind of an issue, whether it be a fetal malformation or a maternal issue or a preterm baby, COVID as well, that's included, to give them a heads up, because they are our partners in this, because it is two people, it is not one.
Yeah,
We
that's
try our
right.
best to definitely keep them updated and get their recommendations and their knowledge and et cetera. So we are definitely a team in that.
That's right.
Okay.
Sure.
So Dr. Jetty, we've heard from Dr. Pareja what they do from the obstetrical side to help with a positive COVID patient. What do you do from the pediatrician side when you enter the room then and the delivery's going on?
With the delivery going on, and if the mom is positive, then all of what Dr. Pareja had said is done, but then the baby is immediately taken care of, just like any other newborn, following all the precautions for the sepsis and avoiding the exposure, and if at any stage. But then after that, then that comes to the point where the baby is going to be taken care of. But that is something that is already discussed with the parent even before the delivery occurs, because typically there's more, people do encourage rooming in, having the baby in the mom's room. So those were the things that were being done all the way through. But now with the COVID, we do need to educate the parent about the risks and the benefits of it. So then there are so many other details that go into it, like how is the mom asymptomatic, or if the mom actually tested positive. So those are all the things that would help to determine what we do with the baby after that.
Wow, that's certainly not an easy decision to make, is it? So Dr. Pareja, when do you start to have that conversation with the mom and the family about where does the baby stay after delivery?
I think we would talk about that at admission. It would be the point at which would be the best time, just that they have time to mentally prepare for that and plan for that. But yeah, definitely discuss at any point once we know the patient would be presenting positive COVID.
And so where would the baby stay then if the family decided that it was in their best interest that the baby was separated from a positive COVID mother?
Yeah, to start back, they need to be educated, so they're the ones making the decision. And then once they make the decision, it can be two scenarios. They can still choose to have the baby in the room, like even if mom is COVID positive, but they have been already 10 days past since the mom first developed the symptoms. And then also that she's fever-free for 24 hours or more, longer than that, then the baby can still stay with the mom. So, but then they can also know the option. There's another wonderful option where the baby can actually be taken care of by the nurses, who are really wonderful and capable of providing the best care for the baby. So then the baby can be in the nursery being taken care of by the nurses.
So it's not an automatic decision that's made where the baby stays. It's actually in conjunction with the patient. What I like that I heard is that they're given education, right? And they're an active participant in making that decision. Do you think that that's helpful for the families to have that education and be part of that decision-making process?
Yes, definitely, because they're making the decision, then they own up to that, and they know they're part of the whole planning.
So you've mentioned about how the baby can stay. Is the newborn automatically tested for COVID? How does that work? The infants born to COVID positive moms or suspected cases of COVID moms, then yes, those babies are all tested. They're all tested at 24 hours. And then if that test comes back negative, then you repeat another test at 48 hours. Okay.
But if the baby is well and asymptomatic and no other problems, it shouldn't really delay them being discharged home. This baby is a well baby and asymptomatic, and nothing else is different from any other newborn.
For those in our audience who may not know how the baby is tested, can you just briefly describe what that's like for the infant? Be tested actually for COVID?
It's a PCR test by a nasal swab, or it can be right, just like any other viral infection,
Okay.
the viral testing, the viral panel is done with the swabs.
Okay, so the swab goes into the nose, if I
nasopharynx.
understand correctly, right? So it's not a blood draw or
Yeah.
anything like that. Now, will the newborn receive their normal immunizations and other types of regular treatments that they get?
Yes, a newborn is a newborn, and we are not going to worry about whether the COVID is there or not, because all these other things that we need to do to prevent other infections and the care. So one of the first vaccine that they get is the Hepatitis B vaccine that is given before the baby is discharged home. Then the baby receives the antibacterial prophylaxis for the eyes, the ointment that is done, and then all the routine care is done, and the newborn screening is done. And so the baby is just as any other baby, but still keep taking care of the precautions that everybody, the caregivers, are following. So good hand washing and masking and doing that. The other thing about this is rooming in of the baby. Like if the moms have decided to have the baby rooming in while they're still in the hospital, and that's encouraged too, because there's a lot of benefits having the baby in the room, but the mom needs to remember that not many people going in and out of the room, and the baby not going in and out of the room, and then following the precautions of masking and then social distancing and good hand washing repeatedly. You can't overdo that.
Oh, great. So hand washing, right? Probably something we needed to do more anyway
Yeah.
before COVID came along. So what would you say would be your recommendation for breastfeeding?
Yeah, the breastfeeding is the best nutrition for the baby. The breast milk provides not only the good nutrition, but also the immunity and protection against infections. So that is recommended. And so far, the data hasn't shown any coronavirus being present in the breast milk. So the breast milk is the best for the baby still.
Okay.
But then with the act of breastfeeding, then that puts them at risk of the closeness of the baby with the mom. So if the mom has any symptoms or concerned about it, then that's where the problem comes. So she should still follow all the routine social distancing, the contact isolation, like so wearing the mask again, good hand washing again. And if she's going to be pumping, then she needs to make sure before she handles any of the pump or the bottles or anything, she's again washing her hands really well. And then if it's possible, if she chooses to, she can always have the expressed breast milk to be given by another provider who's healthy, but still following all the social distancing and the contact, avoiding the exposure.
And do the nursing staff at Adena Nursery, are there folks there that can help teach and educate particularly
Yes.
new moms who might not be familiar with breastfeeding and pumping and all those?
Yeah, and that was all being done even before our COVID era. So that was all being done while the mom is there and helping them to latch on and helping the mom, because the mom is new to the breastfeeding and the baby is new to the breastfeeding. So they needed a lot of teaching, and the nurses are wonderful in helping the mom get through that phase. Yeah.
I've heard that the nursing, both in the newborn nursery as well as in labor delivery, have been just fantastic in working
amazing.
through this,
Absolutely.
and really will help the families step by step through this
Right.
whole process. Dr. Pareja, you mentioned before some of the changes in the prenatal visits.
Yes.
Just a couple of more specific questions that probably our viewers have. You mentioned one support person. Is that of the patient's choosing? And
Yes, it doesn't have to be the same person every time, but we do ask ideally that it is only one person. Unfortunately, it does not include children under the age of whatever. It doesn't matter if they really don't want children in there either, or we really don't. Just for the protective aspect of that, we do understand that your father and mother may both be living with you and you all share the same air all the time, and that it really shouldn't matter. We understand that, but for recommendations that were given to us, it is still just the one person.
okay. Now I know that expectant mothers go through lots of different tests at different times.
Correct.
Are all expectant mothers going to be automatically tested for COVID-19?
So no, and we ask that unless you're symptomatic, you don't get tested for it. There is only the instance on labor and delivery where we will test mothers rapidly if they're going to go for an unexpected C-section, then we will test you for that. And that allows us to appropriately attire ourselves in the OR to prevent exposure of you or of ourselves to baby as well. So yes, that is the only instance that we will do that.
Thank you for that clarification. Absolutely. Switching gears back to you, Dr. Jetty. So we've talked a lot about Dr. Parecia and how she gets the expectant moms ready, and we talked about what to expect during delivery, and particularly if you happen to be a COVID positive mom. You've done a great job at telling us about the nursery side, but like everything else, that all ends and we go home, right? And so tell us about that transition. What should we do, or what can moms do and families do to protect newborns once they go home?
Yeah, so I think that is the most exciting part for any family, a newborn, and now the mom is bringing the baby home. Now everybody in town wants to come there and stand in a line wanting to see the baby, and that is something that we always discouraged even before all of this happened, because most of the time, whether it's the flu season or any other time, the babies are prone to getting them, like if they're exposed to people with that. So we always educate the parents not to have too many people, and especially even during special like holiday time, like now with Thanksgiving coming or Christmas coming, everybody wants to be there. Everyone wants to pass on the baby from arm to arm, and that is something that is discouraged completely, now even more so because of the social distancing. So you do need to make sure, help the family to understand, yes, the baby is there and the baby is healthy, but we need to limit it to just the family that is living in the house. So that includes mom and dad and the siblings, and if the grandparents are there, but they're all staying in the same household.
Okay.
But we do need to, and it will be easy to let the family know, the extended family, when you communicate with them right in the beginning, they're able to understand, and I don't think there would be any problem.
Any recommendations that you would have for bringing home a newborn into a family that, let's say they're not the first child, so they have older siblings, one of them might be in a preschool, one might be in kindergarten, or maybe even junior high, they're going back and forth to school. Any advice?
Yeah, so that would be the difficult situation for a parent, for a couple having their first baby. Everything is perfect. They can plan exactly the way they want to do, and don't do this and don't do that. But then when they have an older sibling in the picture with us welcoming the second baby, it becomes a little tricky. So each family will have to come up with their own plan, because there's no cookie cutter type of plan. So based on the extended help that they can get, and who can take care of the sibling, it's always important still a lot of hand washing and keeping the area where the baby is clean, and plus for themselves too. It's not just about the baby, but anyone who's coming in contact with more people, then they're exposed to the viruses too. So now with the baby being at home and the mom is at home, I suppose, and dad might be going to work, but the older siblings going to preschool or kindergarten and all that, then coming back home, they do need to have a routine in place where as soon as they come into the house, then they're cleaned out, have a wash hands, and then only then touch the baby, and which should be like that even for any other time too.
Can you talk a little bit about is it still important for the newborn baby to still come in for their regular well child checks and actually travel in to the office?
Yes, absolutely, because there are so many things that the newborn, it's really hard for a new mom to know everything that she needs to know about a baby. So it is important to be in touch with the medical personnel, even on the phone. But then the baby needs to be brought into the office, because we do need to make sure baby is being nourished well, the baby is eating well. And so we do need to weigh the baby to make sure that the baby is gaining weight. And then the babies have other problems like having jaundice, because right now the babies go home right after 24 hours or 48 hours. And then so we can have the jaundice going up. So we do need to see the baby. So it's important. But they do need to take all the precautions and how they're moving and not having too many people around the baby. And then what we have done in the office too, limiting the time that the baby is in the office. So we are able to pre-register the parents, the babies, even while, like the previous day itself. So the girls at the front get all the information. So when they come in, they're not even standing at the front desk. So they're taken immediately into a room. And then once they're in the room, there's one clinician that goes in, takes care of the baby, and then comes out, and the doctor goes in. So there again, we are limiting the number of people that are in contact with the baby. And then after that, even before they leave, an appointment is made for the baby for the next appointment, so that mom doesn't have to stand at the window again to make the appointment. So the time is being limited so that it limits, decreases the exposure. So those are all the things that we have in place.
So just like the obstetrician's office,
Yeah.
you're making those changes for that one-to-one contact
Yeah.
and making sure that you're limiting how many different people they're interacting with. That's great. We do have some questions. And
Yes.
so
Okay.
the first one is more of an obstetrical question. So I'll ask you, Dr. Pareja, should you quarantine in advance of the delivery date? And if so, how far in advance?
Right. No, awesome question. I wanted to hit that too, so I'm glad you brought it up. So we are recommending about a 2-week self-quarantine or family quarantine if you can. But self-quarantine, if you have an induction date or a C-section date, etc., yes, 2 weeks is what we recommend. We are more than happy to provide documentation for you to your work stating such. If there are any financial issues that you are still unable, regardless of any documentation that we give you recommending you be quarantined, then we recommend that you still abide by all of the things of social distancing, mask wearing, etc., until your due date.
Okay.
Or until the day you're.
Thank you.
Yes,
Dr.
sure.
Jetty, the question for you is, at what temperature do you call or come in for your child, or when you think you should get your child tested for COVID?
Yeah, for any baby, like this is apart from the COVID, any baby less than 6 weeks of age, a temperature of 100.4 is significant. So we always teach the parents, like if they do have a temperature of 100.4, and then that's another thing to say is it's a rectal temperature, not just any temporal temperatures and things like that. So we need to be accurate. So if they are, then they do need to call the doctor's office, and then we do talk to them, and then based on the other symptoms, and we most of the time, with the temperature of 100.4, we see the baby in the office and check the baby for anything else. It doesn't have to be COVID. It could be something else that still needs to be taken care of.
Okay, thank you. Another question for you, Dr. Pareja. Yeah, if you get sick, if a pregnant patient gets sick and they're a COVID potential, what should they take for as far as medications?
Right. A lot of the symptoms that we're seeing around here are those that can be dealt with conservative management, right? Some say it's a lack of taste or smell, and those are things we commonly see with just congestion in general. So we have those as a neti pods that we use, I believe. Those are good, just kind of help clean out the sinuses, and much more of a conservative management. Tylenol is good, ibuprofen is a no-no. But things like that are over the counter, certain forms of decongestants, are okay, and we give you that booklet first trimester, which I totally understand if those are a missing array, so you can always call us and ask us questions as to what you can and cannot take. But there are conservatively managed options that you can use just to keep you comfortable. But yes, absolutely.
So if they're in doubt, they're always welcome to call the office.
Yes, we have nurses that are there to answer your phone calls and your questions, and they come right back to us and ask us directly. So don't feel like they're making this up on their own. They're very educated themselves, but if they ever have any kind of issues, they do always ask us.
So let's also have this question also apply to you as the pediatrician, Dr. Jetty.
Yes.
What can children take, and does it matter what age they are, and that
for
type
children,
of thing?
it's not just one answer. It all depends on the ages.
Okay.
So like I said, like less than 6 weeks, yes, we don't give any Tylenol or Motrin, and especially with the Motrin, not less than 1 year of age. I mean, they can give them even for 9 months, but I usually hold it off till 1 year of age. But yes, it's all mostly all the symptomatic treatment. It's not just giving the medicine. So if the baby has any temperature, we need to actually check the baby to make sure what the cause of the fever is. And then if it's congestion, using saline drops and suctioning and those are type of things. There's no specific medication as such that we give.
And do you also provide that type of education at the well child checks
Yes.
as well?
Yeah. Mm-hmm.
So if
Yes,
it's
we
a
do.
2-week visit versus a 2-month visit versus a 2-year visit, you'll provide them with
Yeah.
education about what they can give, the proper dosing, what not to give.
That's right. We
Perfect.
do it in the way of talking to them while they're there for the visit, because we see them right after delivery, like 2 days after going home. Then we see the baby again in 1 week to make sure that the baby is gaining weight well. Then we have the 1 month, 2 months, 4 months, 6 months. So with all of that, not only just talking to the mom, because we can talk so much, but by the time the mom goes out of the room, I don't know how much of it you can remember when you have so many other things on your mind. So we actually give handouts like this for each age group. So at the back of it, we have a tabulated column where, based on the weight of the baby, the medication, how much they need to give and all. Because with the children, everything depends on their the body weight. It's not one dose that we can just say give it that much.
Thank you. We're nearing the end of our time here. It's gone very quickly, and both of you have given fantastic advice.
Thank you.
And hopefully our audience has gotten a level of comfort in understanding what to do in the event of pregnancy or newborn. In the event of if someone is pregnant and they find that someone living in the home, whether that's another child or their significant other, is tested positive for COVID, but they themselves are fine or are COVID negative, what would be your recommendation that they do in that case?
Pretend like you're positive, unfortunately, because your exposure to that person, whether it be your child or your significant other or whomever it is that stays in the home with you, if this person, whether symptomatic or not, was tested for whatever reason and is positive, you have to assume that you are too, even if the test is negative, because you have been likely eating, drinking, washing, all of the things very closely with one another. And I would recommend that you would self-quarantine or quarantine together for 2 weeks, same time period.
So it's okay for them to self-quarantine together. You don't, is not the recommendation yet that they have to move out for 2 weeks.
If it was your child, if it was your significant other, if you found out they were positive and they've been positive for days, you've been exposed for days. So there's no point in sending anyone away that could potentially be positive, although asymptomatic, which is what we often see, right? So we'd like to keep that definitely closed in the same area.
Gotcha. Would that be the similar advice that you would give if it was a...
Definitely. Yes.
Understood.
Just try to isolate as much as possible both the patient and the person that you're thinking was exposed to. And then one other thing that I would add to, like taking a newborn home, like I know it's the exciting time for the families and everybody wants to see. So one important thing, the good thing is we live in a very digitalized world. So the social media is a really good benefit for us. So using the social media in terms of the video applications, the baby can be shown to the whole world. So you can actually enjoy sharing the joy with the extended family through the video applications, whether it is Zoom or Skype or FaceTime. So that would be something that we can keep the people away, but still have the whole family included in it.
That's a great idea. Thanks for reminding us about that. One last question for you, Dr. Jetty.
Yes.
We know that a lot of kids are going back to school, and they've already done so. And the majority of schools, I believe, in our area offer, if not a blended or a full-time in-person education. What would be your recommendation if you found out that someone unrelated, someone at your child's school tested positive for COVID? What would be your recommendation for your patient? That should they go to school? Should they stay away from school? Should they go about their daily life? How do you manage that?
That would be the toughest thing, and I don't know who will have the answer for that, because we are struggling with it too. So it's going to be hard when they're in the school, in the class. Then how do you define a significant contact? Like when you're saying then the child has, like if the child is symptomatic, and yes, definitely we would say that child needs to be quarantined, because otherwise that child will be exposing the others. But then as long as we still keep continuing to follow social distancing, so having the mask, keeping the distance, and good hand washing, and keep repeating those things, I think it would be good. I don't think we need to keep everybody away just because one child got sick. So, but that can keep changing, even like overall from the CDC too, because we are all learning and the learning is evolving, so it keeps changing to the recommendations.
Even more important than to keep up to date with those
Yeah.
and to stay in close contact with your primary care provider, pediatrician, nurse practitioner. Well, thank you both very,
Thank
very,
you.
very
Yes.
much. Dr.
Yes, it
Jetty,
was
Dr. Pareja,
excellent.
you've been a joy to have on our program today. Very valuable. I hope that you've learned a few things along the way. For those of you that are expecting, congratulations, and you're in good hands. And we know that this may be an unsettling time for you, but hopefully what you've heard from Dr. Pareja and Dr. Jetty will help you make that transition perfectly, even though we're in a COVID world. Again, thank you to both of you
Thank
for
you.
joining
Thank you.
us.
Yeah, it's a
We
pleasure.
look forward to seeing you again in 2 weeks on September 24th. Our topic that day will be COVID-19 and the flu. How are we going to determine the difference? And so stay tuned, because that's going to be very important as we start to enter the natural flu season anyway. We appreciate all of you and fantastic day. Thank you very much.